It's a real pleasure to speak to you all today. I usually don't speak to such a large group of people of such diverse background. This is a topic which I've been interested in for nearly 30 years. And as you'll see, although we know a lot about fetal alcohol syndrome and now what we call fetal alcohol spectrum disorders, there's much we don't know. And what we really haven't done is we really haven't been able to put a dent in the prevalence of this condition, which is much, much more common than people recognize. And the one feature these children had in common was that their mothers drank alcohol heavily during pregnancy. So when Drs. Jones and Smith saw these children, they said that fetal alcohol syndrome should be diagnosed in children where there was a confirmed history of maternal alcohol abuse during pregnancy. In this 2003 study of over 1,300 Swedish women, they found that of these women, 46% reported binge drinking, and they defined binge drinking as greater than 6 drinks on a single occasion at least once a month. So almost half of the women binged at least once a month. And that 6% of these women reported that every time they had a drink, they binged. But the most concerning thing is that 30% of these women, who were upper middle class, well-educated women, continued regular alcohol use throughout pregnancy. And the CDC in Atlanta has estimated that 57% of South Dakota women of childbearing age between the ages of 18 and 44 drink alcohol. And that almost 20% of women of childbearing age admit to regular binge drinking. That many of these women, these 20% of women who binge drink, would continue to drink during pregnancy, and that puts a significant number of pregnancies in South Dakota at risk for having children with fetal alcohol spectrum disorders. What I'm going to talk about next is how you make this diagnosis, and it's important to make a diagnosis in these children. What you'll see is that this is a multidisciplinary diagnosis. The medical part of this is extremely important. It's not the only part of it, but it's extremely important because the phenotype, the behavioral characteristics, although are very common in fetal alcohol spectrum disorders, they can be seen in children with other conditions as well, as can the facial phenotype. So it's important when you think about this in a diagnostic way to think about a multidisciplinary team, which includes a pediatrician or a physician who's been trained to recognize causes of disabilities. There needs to be psychological and neuropsychological testing. There needs to be an excellent maternal interview in a sympathetic environment which is non-threatening, and the woman feels that we're really there to help her and her child. And then there needs to be a team meeting in which the whole diagnosis is discussed. So this is a diagnosis which, from a medical standpoint, we look at the development of the face to help us with. And it turns out that, as you might have expected, the primary target of alcohol is the developing brain. Alcohol kills cells in the developing brain of the embryo. I'll show you an example of that. And it causes cells to migrate to parts of the brain they shouldn't be in. And so these children have problems in development of the front part of the brain, the forebrain, and because of that, the middle portion of the face is undeveloped. And I'll show you that here in a moment. But what we look at in these children is we look at the morphology of the face. Because the brain is affected, the brain doesn't grow well, and the children have a small head circumference. So we measure the distance around the head, and generally the head circumference is below the 10th percentile in children who are on the far end of being affected by alcohol. They have this underdeveloped middle portion of the face. Your eyes are really the only portion of your brain you can see externally. The eyes are part of your brain, and so the brain is small, and because the brain is small, you would expect the eyes to be small, and in fact they are. And the opening for your eye is made to accommodate the size of your eye. So if you have a small eye, you're going to have a short opening, which is called a short palpebral fissure. And then finally, the pink portion of the upper lip has been stretched thin so that this little dip in your upper lip, which is called the Cupid's bow, that little dip in the middle of your lip, is obliterated. and actually the whole area of the upper lip is diminished in size. In 1996, there was a panel that was put together by the Institute of Medicine, and they identified 4 diagnostic categories within fetal alcohol spectrum disorders. There was fetal alcohol syndrome, partial fetal alcohol syndrome, alcohol-related birth defects, and alcohol-related neurodevelopmental disorder. Fetal alcohol syndrome was defined as a child who had 2 of the 3 cardinal facial features. Partial fetal alcohol syndrome was defined then as children who had the face, 2 of the 3 cardinal facial features, and then were either growth deficient or had a small head circumference. This is a category which isn't used very often, called alcohol-related birth defects. These are children who have the facial features of fetal alcohol syndrome, have normal development, normal growth, but have a birth defect like a congenital heart defect or a kidney abnormality or one of the other common major birth defects seen with fetal alcohol syndrome. And these are children with alcohol-related neurodevelopmental disorder. Now, these are children then who don't have all 3 of the facial features. They maybe don't have any of the facial features. But mother drank in pregnancy. You must know that mother drank in pregnancy to make this diagnosis. As I said, this is a multidisciplinary diagnosis. The dysmorphology examination is very important. However, it's also important that these children have educational and psychological testing. Often, if there is a neuropsychologist, it's good to have neuropsych testing. Then finally, the maternal interview is important. It's important to do IQ testing on these children, but IQ testing alone will not differentiate this condition from other disabilities. The estimates from the United States for all of FASD are about 1.7%. So in conclusion, we feel that fetal alcohol spectrum disorders is really this continuum of disability. And we use these revised Institute of Medicine diagnostic criteria. There are a variety of other schemes that people have used. We feel that the earlier you can make this diagnosis and intervene, we feel the long-term outcome of these children can be improved. You need to have a multidisciplinary team that uses a medical professional, educational, psychological, and neuropsychological assessments. And we hope that as we move forward, we'll get beyond just looking at diagnosing and treating and actually work now, as we're beginning to work in South Africa, to change societal norms about drinking in pregnancy. So we have to find a way to really get the word out about this condition.